Good afternoon. Thank you all for joining us for the Tipping Points webinar program sponsored by the Foundation for Food and Agricultural Research. We're first going to just go through some logistics for the day, and my colleague Tatiana is going to go through that for us.
All right. Thank you all again for joining us for today's webinar. I have a few housekeeping items I wanted to go through before we begin. This webinar is being recorded and it will be added to our website following today's session for anybody who couldn't attend or if you want to refer to it later. All attendees are muted, and as we go along through the webinar, please feel free to add in any questions to the Q&A box, and you can find that at the bottom of your toolbar. We will answer any questions that you have at the end of the presentations, and if there's anything that we are unable to answer live today, we can pass them along to the appropriate people so we can follow up with you after the webinar. And with that, I'll pass it back to John, our scientific program director, who is spearheading the Tipping Points program.
Great, thank you, Tatiana. Next slide, please. All right, so our agenda for today is that I'm just going to do a quick overview of the Tipping Points program. We're going to talk about some of the projects briefly, and then we're going to have the different grantees present each of their projects. I'll have about 10 minutes to present, and then we're going to have a panel Q&A after that, where y'all are free to ask questions through our Q&A chat box. So we'll get started. Next slide, please. So I'm John Reich, and I'm with the Foundation for Food and Agricultural Research. I've been with this program from the beginning, and I'm very pleased to be having this webinar today. The Tipping Points program, which is what we're talking about today, was one of my initial programs here at FAR. The goal of the Tipping Points program was to create a research program that helped us being the public as a whole, including researchers, policymakers, et cetera, to understand how to move from nutritional insecurity to nutritional security. So the question for us is, how do we get there? We already knew that there were a lot of programs focused on nutritional insecurity, a lot of really great work going on at multiple levels, national, state, local. And however, while there were a lot of great efforts and a lot of great people and organizations working to alleviate nutritional insecurity, we wanted to understand the impacts different interventions were having and whether we could be doing things differently. So given that nutritional insecurity is just one aspect of poverty, the connections between nutritional security and other parts of society, whether at the community, regional, or higher level, could be important aspects to target to ensure long-lasting nutritional security. So we guess that some of the interventions we are currently spending money on, which are important interventions, are treating the symptoms rather than the cause. Not all of them, we hypothesize. So if we are just treating the symptom, then the underlying conditions that give rise to the symptoms are still present. So this is in contrast to, for us, treating the cause, even if that cause is not directly connected to that symptom, which we feel could have long-lasting impacts. So this is the lens that we at FAR took as we developed this program. So we were really looking at, can we do more? Are we looking at the problem wrong? Are we treating symptoms rather than causes? Next slide, please. So we were interested in understanding where we can impact change, which for us meant moving towards understanding nutritional security from a more systems perspective. Ultimately, we wanted to move more towards understanding the causes of nutritional insecurity, and eventually targeting specific interventions, which could be novel interventions or not, could lead to greater impacts. Remember, food systems are systems that are also part of larger systems. So if the goal is to promote nutritional security, should we limit it to this space? So for us, this would require a more holistic approach. Remember I said earlier, nutritional security is just one aspect of poverty through a food lens, and this program is really focused on marginalized populations. So we didn't want to have a program that was really a top-down approach. We really wanted to work with community and community insights as we are doing for this program. Next slide, please. So these are just stats for the program that we had. This program was funded in 2018. FAR's funding awarded 4.3 or roughly 4.3 million to 5 multidisciplinary research teams, where they were looking at understanding food system components and nutritional security. Next slide. All right, so we started off this program with the ultimate goal of to increase our understanding of food systems by determining the most promising areas to target for change and the trade-offs associated with potential changes that lead to greater health and well-being. So rather than create standalone initiatives, we wanted to understand the impacts of disruptions to the food system with the intent of increasing food and nutritional security for marginalized populations. So we created a program that we hoped would help in understanding how disruptions impact the food system for good or bad, and how they can lead to sustainable change. Ultimately, we wanted sustainable solutions and left the RFA open to what was targeted or researched in food systems. So we had a few requirements of the program, which are listed on this slide. Really, we wanted the groups who applied to this program to leverage on-the-ground investments. We wanted them to collect and analyze data, and had some elements of computational modeling. Next slide, please. So we funded, as I said at the beginning, we funded 5 projects. So the next 2 slides are just highlighting these projects. We had projects that focus more on specific interventions and specific parts of the food systems, and others that were focused on communities. And so most had elements of system science to them. So the slides, the projects we're going to hear about today, I'm just going to briefly mention. We have a project in Texas focused on food access and affordability, where FAR provided roughly 1 million of support there. We had a project in Colorado, really looking at regional procurement. FAR also provided roughly 1 million there, and one in New York looking at fresh produce recovery and distribution, where we provided roughly 0.43 million to that project. Next slide. And then these last 2 projects were focused on communities and transforming the food system. So Ohio, the focus was maximizing the equitable impact of food system efforts. We funded about 1 million there. And Michigan was looking at leverage points to positively transform food systems, and we funded about 1 million there. So now that we are nearing the end of the program, I'm really happy with the progress that the PIs have made, in addition to leveraging the grantees' collective knowledge to determine if the program can have greater impacts. But I'm going to stop there, as the PIs will be able to highlight their research momentarily, and my colleague Rebecca is going to talk more about our interest in leveraging the collective knowledge of the group to make greater impacts. Rebecca.
Yes. All right. Thanks, John. So hello, everybody. I am Rebecca Jewu, Scientific Program Officer at FAR. I will be speaking about our collaborative approach, which is very unique to this group. I will be highlighting some of the major events that happened over 4 years together. And we like to call this a community of practice, and who met monthly in the spring and fall semesters over this time period. As John mentioned, the award was made in 2018, and we got the group together in 2019. We held a convening event in New York, and the group got to interact in person. And in 2020, we began our monthly PI and modelers meeting. And this we thought was very important, especially for the modelers, because they were in a unique space. And overall, the purposes of the meetings was to learn about one another's projects and offer advice and potentially share some of their methods and practices that may benefit each other's projects. And then COVID sadly hit in 2020. So we shifted the focus and wanted to understand how the food system was responding to COVID. So FAR awarded a supplemental fund to each project to expand on their objectives. And then when they were done with working on their project, the group got together to write a paper together. So I'll speak a little bit more about this in my next slide. But also in 2021, we continued meeting and sharing learnings across each program. And in 2022, we held a message box workshop. And the purpose was to use a tool called the message box to communicate research and the so what of each studies. So after that, the group started working on a second paper, which was accepted this year Woohoo. And the group is currently working on a third paper. Next slide, please. And so, as I mentioned, FAR awarded a supplemental COVID fund, and because we saw an opportunity to understand how the emergency food system was reacting to the COVID crisis and where investments could help the most vulnerable. So FAR provided $10,000 additional funding to each project in Feeding America, and no match was required for this. And so findings from this work was first published in September 2020. And FAR also did a blog post about that. Next slide, please. So this is a quick overview of the joint papers that we did together. I would say that individually, each team has published a lot of work from their respective projects, but here is an overview of the collaborative or the joint papers that they did together. That I mentioned earlier. So the first was on the supplemental COVID fund, which looked at the emergency food provision for children and families during COVID across all 5 cities. This was published in the Applied Economics Perspective Policy Journal. And the second, as I mentioned, was recently accepted in the Environmental Science and Policy Journal. And it looked at navigating community engagement in participatory modeling of food system. And the third paper is currently being developed, and this title may tweak as it gets developed. And so I want to commend the PIs and their teams for amazing work and getting together to work collaboratively on this project. So I will now hand it over to John to introduce our next session and also the next speaker. Thank you.
Yeah, and I just want to reiterate what Rebecca said. This group has done a lot of really great work together and has met on a consistent basis. And we at FAR here really appreciate it. All right, so we went over the overview of the program. Now we're going to get into the PIs or the grantees research, and we're going to do it in a specific order. So I'm just going to call out the researchers or the team that's doing it. They'll present. You'll have a chance to save your questions or ask them in the Q&A, which will happen during the panel session, and each team has about 10 minutes to present before we get to the panel. So our first team is Michigan State University.
Hi, thank you very much. We're excited to be here for this important webinar. I'm Dr. Chelsea Wentworth at Michigan State, and I want to emphasize that I'm just one member of a large community and interdisciplinary academic team. So I'm grateful for the opportunity to present our findings on behalf of our team and partners here. Next. So our project is based in Flint, Michigan, in partnership with the Community Foundation of Greater Flint and supported by a community consultative panel of food system experts in the area. We aimed to map the food system and identify leverage points to induce positive change and to reduce food apartheid in Flint. And these goals were framed by our community partners from the onset. Our team engaged in interviews, workshops, a photo project, fuzzy cognitive mapping, and participatory system dynamics modeling to ultimately develop a series of scenarios for improving the food system in Flint. So very common in Rust Belt cities, there is a tension between investment in emergency food services and the desire to build innovative programs to redefine the food system. And of course, we need to support emergency food programs, but this isn't sustainable in the long term, and it often comes at the expense of investing in large-scale projects that could help break people out of poverty. Next. So at the conclusion of our project, our core community team worked to synthesize the results, and we framed these in a series of 4 pillars of action. And each pillar defines the current state of the food system, the future that the residents desire, and additionally, each of the 4 pillars of action included community-identified leverage points, stemming from modeling activities and qualitative research that could help launch efforts in support of the desired outcome. And leverage points were classified in 3 areas: downstream actions that address individual needs and crisis management, midstream actions that address barriers to system change and support individual and community needs, and then upstream actions that include policies and laws for improvement at the community level and can create a broader system-wide change. And our results emphasize that it's important to address actions at each one of these 3 points. Next. So as I talk about our 4 pillars of action, you'll see a snippet from infographics that we designed with our community partners, and all of these are available on our website. So the first pillar of action we call the emergency response loop. Currently, the food system is focused on supplying emergency food rather than preventing need due to current high demand and needs within the community. The desirable future exists where food system changes the need and reduces the need to access emergency food services like food banks and soup kitchens for greater food independence and resident food equity. Next. The second pillar of action we call economic investment. Currently, economic investment is heavily focused on emergency food distribution rather than on preventing that need in the first place. Jobs are low paying and ownership of the food system lies with people who live outside of Flint. A desirable future is achieved when, after drawing on the many assets within our community, future economic investment results in Flint-based ownership within the food system. Economic development fosters cultural growth, is culturally appropriate, and improves the quality of life for all residents. Next. Our third pillar of action we call community collaborative action. So currently there are limited resources and silos put organizations in competition with each other for funding and promotes a real self-interested collaboration and limits system-level innovations. So in a desirable future, community service providers will collaborate with resource providers, the government, nonprofits, residents, faith-based organizations, and retail, all for mutual benefit. And this will help achieve authentic community-based collaboration across all sectors. Next. And finally, the fourth pillar of action we call resident food empowerment. So currently the focus on emergency food and meeting immediate needs limits work that will transform the system and achieve equity and food sovereignty. Residents desire a future with increased resident direction, control, and ownership of the food system, which improves food access to achieve equity, social, and economic justice for residents. Next. So as you can see, these 4 pillars of action, there's some overlap and they each coalesce around our primary finding that while we need to support emergency food programs, that's not a sustainable approach to fixing the food system long-term in Flint. Investment solely in emergency food prevents the kind of innovative investments in the system level that could transform the food system by breaking people out of cycles of poverty. And this is supported by feedback on the project as a whole from our community partners. And so I pulled together some quotes that they shared with me on reflecting on this process. And I wanted to bring the voices of 3 of our partners here through these quotes to help illustrate our findings. Our project framing focused on building partnerships and collaboration, which greatly improved the outcome of this project. And one partner reflected on that aspect in particular, stating, quote, "I have found that the research that is done with communities rather than on communities is the most helpful in my work," end quote. So some of our partners are already acting on our findings through small grant programs and have explained, quote, "Research gives us leverage and context when making a case to funders to support certain projects," end quote. And finally, one of our partners offered this succinct summary of our results, stating, quote, "No single organization, much less a single individual, can play the superhero role in to bring about a happy ending. The scale of the issue is such that communities must find their way to effectively work together in order to address the challenge," end quote. So this speaks to the importance of moving away from the idea of a silver bullet solution toward a more true cross-community collaborative process that addresses these downstream, midstream, and upstream components of the system. Next. So there are several tangible outcomes from this project so far. And if you visit our website, and can you animate the slide, please? You can click at this button here will lead you to all of our resources and publications. And in addition to our peer-reviewed journal articles and publications, we have a number of community-focused and policymaker-focused resources and publications that are all available to freely download. So we have a series of policy briefs, interactive maps, photos, the scenario results, and all of these summaries are on our website. Additionally, at the Flint Food Policy Council, which is just forming now, members are using the project results to help inform the development of their goals and the work that they're doing. So that's a really big, important outcome from our project. The Greater Flint Health Coalition and the Community Foundation of Greater Flint are using results to inform new types of data collection based on gaps that we found for their future community health reports and in shaping the direction for future community small grant offerings. And finally, we're building on this for future research. So my colleague Stephen Gray has a DARPA grant to study methods that are developed from this project. And we're really excited about the results of this project because we feel these represent examples of translating research into action, which is really what we were hoping to achieve when we started out. Next. So I'm happy to talk with anyone in the future in more detail about the project. You can reach out to me or my colleagues, and the QR code here will take you directly to our website as well, where you can access that information. So thank you very much for your time.
Great, thank you, Chelsea. Just remember, everyone, that there's a lot of work that actually went into these projects, and they all have great results. At least I think they do. And we're going to be having a panel discussion at the end of this, where you can ask questions through a Q&A. All right, the next team that we have up is from Cleveland, Ohio.
Great. Well, good afternoon, and thank you for joining us today. I'm Darcy Friedman, and I served as the PI of our FAR Tipping Points project that we called the Modeling the Future of Food in Your Neighborhood study. Next slide. As we heard from the Flint team, this work is teamwork, and no single individual or funder can play the superhero role. So I want to take a moment to acknowledge FAR and our many matching funders for supporting this research from 2018 to 2021. Next slide. I also want to acknowledge the many collaborators on this work, including community partners and co-researchers, academic partners, and trainees who helped make this study happen. Next slide. Next slide. So let's start off by sharing why we did this research. The driving question motivating our study was to better understand how to change inequitable health outcomes of the local food system. We wanted to dig deeper into the complexity of food systems change because we had just finished a 3-year external evaluation of a food hub that did not go as planned. As you can see by the title of our main outcomes paper from that research, the food hub did not improve healthy food access, nor did it improve diet among residents living in areas of food apartheid. We looked at this tipping points research opportunity to step back and take a deeper dive into the complexity of local food systems and how they operate at a granular level of the neighborhood. Next slide. So in this research, we wanted to look at neighborhood-based food systems as a whole rather than a series of discrete parts. And we used participatory system dynamic modeling to try and understand the full system by engaging diverse partners in structured workshops where each person helped us see the pieces and parts, and we worked together to integrate these findings into a unified story. So we paid attention to system dynamics, such as feedback generated to either accelerate or delay change in the system, time delays between cause, such as the introduction of a food hub, and effects such as reduced food insecurity, unintended consequences such as the risk of gentrification from investment in urban food systems, and tipping points where a change in one area may have an effect in many areas. We use several different tools to explore this complexity, including 20 modeling workshops with a core modeling team, 6 public convenings, 22 qualitative interviews, and 3 simulation modeling projects. Next slide. Our system science approach was deliberative and situated. We recognize that the food system is complex and that there are not going to be yes or no answers to the questions that we were exploring. We needed a process that allowed for deliberation among many different kinds of stakeholders. We also recognize that our research was situated in a specific context, and for us, that was racialized neighborhoods in Cleveland. Our team worked to account for the social, political, and geospatial context of neighborhood-based food systems, including the ways that historical experiences in these settings were manifesting in contemporary realities. Next slide. So given the short amount of time to share our findings, I'm going to focus on 3 main findings from our work. The first thing that we learned is that systems are designed to achieve the goals, which is a sort of a mantra of system science. If we want to change the outcomes of the food system, then we need to change their goals. Our team identified nutrition equity as a new goal to shape neighborhood-based food systems, which we define as a system wherein people and communities have freedom, agency, and dignity in food traditions, resulting in holistic health. Next slide. Second, we learned that who is leading change is as important as how change is happening. We found that investments and efforts that promote community ownership and food sovereignty is a tipping point to accelerate nutrition equity. Our findings highlight that the people living in racialized neighborhoods should be at the front and center, deciding how food systems changes will occur in their neighborhoods, and should be leading implementation of these change efforts. Next slide. And lastly, we found that modeling and simulations are interesting and important, yet they are not sufficient to flip the food system to fairness. Our team pushed us to translate modeling insights into tools for action that could inform systems change implementation. So with that, next slide, I want to highlight a few of the main outputs related to this focus on action. To promote action within the scientific community, we translated our findings into 13 manuscripts that are designed to shift the discourse to leverage food systems to promote health equity. And 2 of our exemplar papers are highlighted here. To promote action within the community, we created 2 toolkits that are designed to support communities in developing strategies that address food system complexity while attending to the need for community engagement and food systems change efforts. Our menu of actions for community-driven food systems change and the Food Systems Change Vision Board Toolkit were developed collaboratively through this research and are available online for others to use and adapt. Next slide. A big question for our team as we thought about what's next was figuring out how to turn the modeling insights into a systems intervention. We knew there was not a silver bullet solution and that change would be needed to be intersectional to make a difference in the system. So we're currently testing a systems change intervention that we're calling the Nourishing Power Network that is testing ways to transform food systems by bridging community power with organizational power to spark and expand food justice initiatives led by the community. Next slide. With that, I'd like to turn it over to one of our community co-researchers, Michelle B. Jackson. She is also a community leader and organizer in the greater Cleveland community. She's going to share a little bit about how else we were translating our findings locally.
Thanks, Darcy. Hey, everyone. Good afternoon. Thank you for coming out to view this. So, yeah, as Darcy said, I got involved with the core modeling team as originally as a fellow, and then sort of got more deeply involved with other community leaders as community researchers. And where I come from as an activist in one of the neighborhoods that's constantly being studied, I call us one of the usual suspects. Historically racialized, historically redlined neighborhoods. I really believe very strongly in participation civically and through voting, through politics and all that. And so that perspective I brought to the team in terms of really advocating. The research can tell you certain things, but the action part has to include a policy component. So that said, we took the opportunity of election time, a municipal election in 2021. We had two candidates who emerged from the primary process as mayoral candidates. So we interviewed them separately. We really just had a conversation. We didn't do it together. They had already solidified their positions. We just didn't know who was going to win eventually. But it was really great. We wanted to kind of see where they stood on food equity, nutrition equity. How was that a priority in their platforms? From that, once the election happened and we actually had a mayor, a team of us got together and wrote an op-ed that got published in our paper of record, the Cleveland Plain Dealer. Great placement. It was the Sunday before Thanksgiving. You can't get much better than that. And it really was, the title was New Mayor, New Opportunity for Food Justice. And there we sort of outlined just bullet points of this is what this could look like. Understanding that coming out of COVID, it was emergency food, and kind of stressing emergency food, the food banks, that's not a system. And it should really be for crisis, not for how we keep people healthy and have healthy neighborhoods. But one of the things I do want to point to is our very first recommendation was that the new mayor appoint we called her a food czarina to his cabinet, her focus would be looking at food system and engaging with the community. And in 2023, less than 2 years later, we have Ms. Zainab Pixler as our food czarina. She's been doing a great job. She recently submitted a report that she did, with the community. She's got great plans. She will come up against, of course, institutionalized inertia, shall we say, but we're thrilled that we were heard as a collective, that this is something very needed in Cleveland, Ohio, and delighted to see that happen. So that's my 2 cents. Thank you.
Thank you, Michelle. So with that, we'll wrap up next slide with our contact information and our QR code if you want to access any of the resources from our research. Thank you.
Great. Thank you, Darcy and Michelle. Just a reminder, if you're asking a question, just let us know while you ask the question, who's the team that it's directed to. All right. Next project we have up is our team from Austin, Texas.
Hi, good afternoon. My name is Alexandra Vandenberg, and I was one of the PIs for this project that we called the Fresh Austin Study. The other PI was a staff member at the Sustainable Food Center, who is one of our partner organizations. She is no longer at the Sustainable Food Center, so I'll be doing the presentation today. And just like Chelsea and Darcy started out, there are lots of players on our study as well. Only a few of them are listed right here. And I do want to just acknowledge also all our partner organizations that worked with us, plus the city of Austin, who was instrumental in both the implementation of our intervention, but also working alongside with us and continues to work with us on different food system projects. And next slide, please. So just to give a tiny bit of background, the idea of the FAR study started in 2016 when the Austin City Council passed a food access policy that allocated almost $500,000 in annual funding to implement a comprehensive multi-sector Healthy Food Access Initiative. And the goals of the Access Initiative were to increase both the geographic and the economic access to healthy food, with a strong emphasis on locally grown fresh fruits and vegetables. So the City Council passed this policy, which was created by the Food Policy Board of Travis County in the city of Austin, which had a lot of input from the community. What did the community feel that would be most helpful to them to be able to have healthier diets in a sustainable way? So the initiative consisted of placing non-traditional retail outlets in low-income communities in Austin. And these retail outlets were farm stands, mobile markets, and healthy corner stores. So the farm stands were really just small farmers markets that were placed at local elementary schools once a week, so that parents, when they picked up their kids, could also purchase fruits and vegetables. The mobile markets were mobile markets that sold produce and some healthy staple foods, and were placed in different parts of these low-income communities throughout the week. And then in the healthy corner stores were corner stores where the owner or the manager agreed to place, again, locally grown fresh fruits and vegetables, and also healthy meals in their stores, so that people who frequented these corner stores could purchase them. And at all three of the different retail outlets, EBT was offered, so that SNAP participants could use their SNAP incentives to purchase the food that was offered. So the Fresh for Less initiative got started. It was organized by the city of Austin, but then implemented by different nonprofit organizations in Austin. And so it really got started 2017, 2018. And then when the FAR RFP came up, we're like, well, it'd be great to do a really large evaluation of this initiative. And then also, in addition to that, create a model that can then show what would happen if we had more of these non-traditional retail outlets. So with that in mind, next slide, please. We came up with the purpose of the Fresh Austin study. Again, it was twofold. First of all, was to do the evaluation and measure the impact of the Fresh for Less initiative on food insecurity, food access, healthy food purchasing and consumption. And the idea is that we were going to use a longitudinal cohort that we would follow over 3-year periods. And we'll talk a little bit more about that, since COVID happened during that 3-year period. And then secondly, was to use the data that we collected from this evaluation study to come up with an agent-based model that would help us assess the potential effects of large-scale modifications to the food access environment in Texas. And again, we were looking at healthy eating outcomes, and again, predominantly among low-income minority residents. Next slide, please. So just for time's sake, since we only have a few minutes to present all our outcomes, I just wanted to show you real quick a little bit of data from our first study. So this was the evaluation study. And again, because of COVID, we only were able to collect baseline data and the year 1 data. So we were not able to do the whole 3-year study, unfortunately, but we were able to change our study design with the additional funding from FAR and create a different study that still was very useful. But just to show kind of what our population in East Austin, which is the lower income communities in Austin, looks like, is that we're mostly Hispanic, probably not surprising, over about 55%. We have a large group of people that are low income, making under $45,000 for the households per year. And then in terms of food security, we see that almost 40% of our population, which is pretty representative of the population that lives in those communities. So 40% was considered food insecure. And just real quick, our first year of data showed that the people who frequented the retail outlets, so they actually bought food at those retail outlets, and the people that lived around them showed a significant decrease in food insecurity. However, we did not see any significant increases of fruit or vegetable consumption, which was one of our other outcomes, but maybe not surprising given that was only a 1-year evaluation. Next slide, please. So again, so I think there was one for that. Yes, thank you. Again, so we used the data that we collected from this evaluation study to both create and then also validate our model that we created for Austin, Texas. And so this model that we created simulates 3 different things. It simulates the spatial distribution of income and then race ethnicity of residents across the Austin neighborhoods, and the Austin low-income neighborhoods. We informed the development of the modeled environment using both US Census data and then City of Austin demographic data. Then we also simulated the food environment by partnering with the City of Austin, who had just recently conducted a very comprehensive census of all the food stores in Austin. So supermarkets, grocery store, gas stations, convenience stores, any kind of outlet that sold food was audited by the City of Austin audit, and we used those to create part of our model. And then in addition, we added all the newly added Fresh for Less initiative vending points, so the farm stands, the mobile markets, and the corner stores. And then so the model then simulated the population of Austin, represented by 2,100 agents. So those were the simulated people. So each of the agents was assigned a different income level, a different preference level for eating vegetables, and then a different level of time availability. And then that model simulated the agents' decisions with regards to where they would buy their food, what types of food they buy, how much time they spend on food, which include like buying it, traveling to get it, preparing it, and eating it. And then what types of foods were consumed in the end, with our main outcome of interest being the vegetable intake. Next slide. We had originally put fruit and vegetable intake together as one outcome, and really very quickly realized that they're 2 very different behaviors. So we chose one, and we chose to focus on vegetable intake, since that is really what, in terms of when you look at data for what Americans are eating, that vegetable intake is the one outcome that we really need to increase. So anyway, so our outcome was vegetable intake, and we had 4 different scenarios that we used this model for. So we wanted to see what would happen in terms of vegetable intake if we increase the geographic access to the non-traditional food vending outlets. So what would happen if we just put more of those in our low-income communities? And secondly, we wanted to see what would happen to vegetable intake if we improve the economic access. And so that means decreasing the cost of the vegetables or the items that were sold at the non-traditional food vending outlets. And thirdly, we wanted to see what would happen if we improved both the geographic and the economic access. What would happen to vegetable intake then? And then lastly, fourth, we added this later because we decided, it'd be really interesting to see what would happen if we just use the traditional grocery stores, and what would happen if we decrease the cost of the produce in the grocery stores. What kind of outcome do we see then? Next slide, please. So here are the results for the non-traditional food outlets. The first one is what would happen if we increase the geographic access. Secondly is what would happen if we increase the economic access. And then thirdly, what if we increase both? If you look at the different lines, the light green, the bottom one that's pretty straight, represents the healthy corner stores. And then there's another kind of like greenish brownish line that is the mobile markets. And then we have the farm stands, which is a darker gray line. So you can see, and maybe click, can you click? It has a little click on the slide, please. Yeah, there you go. So hold on, we'll do this later. If we increase the number of Fresh for Less retail outlets, we actually do see an increase in the number of portions of fruit and vegetable, or just vegetables per day. However, we have to increase it quite significantly. So if we quadruple the number of farm stands or the mobile markets, then we see a 0.18 increase portion of vegetables per day. Nothing changes at the corner stores. So there was no change, and no matter how many more healthy corner stores we would put in. So secondly, if you click again, please, go ahead and click twice. Again, if we decrease or we have a discount of 70% at the farm stands or mobile markets, again, we see an increase of 0.18 portions of vegetables per day. And if the discount is 85%, we see almost increase of half a portion of vegetables per day. So it's pretty significant and very consistent with other interventions that focus on fruit and vegetable intake. Again, the corner store did not do so well. And then lastly, if you can click again, please. If we did both, if the number of farm stands or mobile markets were quadrupled and we had a 50% discount, then again, we saw almost an increase of half a portion of vegetables per day for the farm stands and a quarter portion of vegetables increase for the mobile markets. Next slide, please. Now, these are the results. What happens if we increase the economic access to vegetables at the grocery store and supermarkets? So we divided supermarkets and small grocery stores. And here we looked at lower income folks, middle income, and then higher income. And you'll see that the slopes are very similar. So the lower income folks start at a lower intake of vegetables, but they have the same increase as the other folks do. So again, if we discounted the cost of vegetables by 50% for the low income residents, we see another increase of 0.18 portions of vegetables per day. And then if you can click one more time. If the cost of vegetables were discounted by 90% for the low income residents, we really see a significant increase of 0.63 portions per day. So next slide, please. In conclusion, in terms of the first aim, where we looked at the evaluation results, the results from that natural experiment showed that there was a decrease in food insecurity among the individuals who used the non-traditional retail outlets and who lived around those within a half-a-mile radius. But no changes in fruit or vegetable intake. Now, the results from the modeling study, we did see that the model predicted the same level of gain, which was 0.18 portions of vegetables per day per resident, by quadrupling the number of farm stands or mobile markets, or by decreasing the cost by 70% in existing non-traditional food stores, or decreasing the cost by 50% in existing traditional stores. So ultimately, if you look at these results, looking at policy implications, it may be easiest to work with already existing grocery stores and trying to decrease the cost of vegetables. And that this can be done in different ways. We currently have Double Up food bucks that we are now evaluating in traditional food stores and seeing a very good impact in what people are buying and consuming in terms of vegetables. For time's sake, I'm going to skip to the last part. What was very consistent across both studies is that the healthy corner store retail outlets were not an effective strategy for improving vegetable intake and food security in Austin, Texas. And as a result, the city is no longer funding our healthy corner stores and trying to find a different strategy to kind of make up for not having those corner stores. But it just wasn't working for different reasons. We can talk more about that in a little bit. But I do want to say that this is my last slide, but these findings are now being included in the Austin Food Plan that we're working on. This is a multi-year project, and we are coming up, and this involves many different working groups, community inputs, organization input, etc. But these results are being considered, so that I do feel that we're having some impacts in what's happening in terms of the food system in Austin, Texas, which is just really cool to see that, right? When your research actually translates into action. And this is my last slide. I did not have a slide with my contact information, but I'm happy to provide that later. And I do also want to say we have about 10 papers published right now, and there are a couple more that have been accepted. So if you're interested in this, I can give you some references for that as well. Thank you very much.
Great, thanks, Sandra. Next up, we have our team from Denver, Colorado.
Excellent. Well, hello, everyone. It's really fun to get to hear all of the presentations from our community of practice, and very excited to be here today representing the Denver and Colorado team on our work, integrating community and modeling efforts to evaluate impacts and trade-offs of food system interventions. Next slide, please. So as with the other presentations, this is a large and interdisciplinary team of Colorado State University researchers. You can see from lots of students and postdocs from across many disciplines. And it really has been a fun 5-year opportunity to, I think, learn how to train more of our T thinkers, as my colleague Michael Carolyn refers to them. So people who have disciplinary depth, but understand how to communicate across disciplines, which I believe is really what we need to be able to solve some of these really challenging problems that we're experiencing. Next slide, please. And we also have had a large and wonderful team of partners and funders. And I just want to highlight that, especially in a place like Colorado, it's not often that you're going to see the Colorado Association of Meat Processors, the Colorado Beef and Pork Council on the same slide with some of our health-focused nonprofits and food access, food security-focused nonprofits like Cooking Matters or Live Well Colorado, that's now Nourish Colorado, or Denver Urban Gardens. And it's one of the things that I've been probably most proud of about this project, is bringing together these really diverse food system actors and stakeholders across Colorado's food system. Next slide, please. So the impetus for this project is that public food procurement policies are probably the most frequently enacted food policies nationally and actually globally. And so we see globally, for example, there are many cities that have adopted the Milan Urban Food Policy Pact or signed on to the Milan Urban Food Policy Pact. They're leveraging food procurement to meet their the UN Sustainable Development Goals. In the United States context, many of our cities and institutions have been adopting the Good Food Purchasing Program framework. And the interesting thing about good food purchasing is that it goes beyond just this idea of purchasing locally to actually integrating these 5 different values into public food procurement policies. And so, at least at the moment, is over 1.1 billion in food spend that's impacted annually. And this number is continuing to grow as many more cities and institutions are adopting into this. Next slide, please. So one of the things about the Good Food Purchasing Program under these 5 different values areas is that instead of setting its own sort of standards and verification programs, it leverages these existing third-party verification programs. And essentially, when municipalities adopt this, they're going to get a series of points and stars based on the purchasing they do under these different third-party verification programs. But one can imagine that if you, as a city, decided that you were going to prioritize certified organic purchases, that might have very different soil health or farm profitability or other kinds of impacts relative to something like a food justice certification that are all under this environmental sustainability. And I'm being a little bit loose here in terms of how the Good Food Purchasing Program works, but thinking about that there is this, there's reason to believe that there is variation in the impacts across these different programs that are really worth understanding and helping cities to really investigate as they're pursuing these kinds of strategies. Next slide, please. So in the discussion so far, I've really been highlighting cities. It really is mainly cities that are leading the charge in some of these food procurement efforts, not exclusively, but primarily. And this is also true because we have about 80% of the population in the United States that now lives in cities, depending on how cities are defined. And so that's where most of our eaters are, and they're setting these policies that really have these important potential impacts. So when we started, when we applied for the FAR Tipping Points grant, it was great timing because the mayor of Denver, Mayor Hancock, had just signed and released this Denver Food Vision. So this was 2016, 2017. 2017 was when it was officially signed. And at the same time, we had just completed, that I was a part of the leadership team for, the Colorado Blueprint of Food and Agriculture, where we did this statewide food plan. And so it was really wonderful because we had this opportunity to think about how do we bring the city and state together to meet some of these goals, especially when you look at things like within the Denver Food Vision, you can see one of these, what they called winnable food goals, that 25% of all food purchased by public institutions would come from Colorado. Next slide, please. But in Denver, as is true in many cities across the United States, we really don't have a lot of urban production that's happening. And so that's not to say that these farms don't play an important role in terms of education or other kinds of support, but they're not going to be able to produce all of the food to meet these cities' goals within their food plan. So you can see in Denver, for example, this is 2017 census data. There were 12 farms, and only one of which had over $100,000 in gross cash farm income. So really what that means is that bringing together the Denver Food Vision with this statewide plan and really thinking about these regional linkages became very, very important, and really the impetus of doing this work. Next slide, please. So the questions that we were really looking at are, what are the regional, socioeconomic, and environmental impacts and trade-offs of public food procurement policies? And then can data on trade-offs support cities in setting their food procurement policies? And the second piece to me has been really interesting because I think one of the things that I've been thinking about a lot, I think as have many others that were funded under this program, is really thinking about, you know, what is the impact of sort of the process that we all went through with these partners? And then how does data and the modeling work fit into all of this, right? Is that an important part of actually seeing the kinds of policy relevant impacts that we've all had through this work? Next slide, please. So when we started this project, I mentioned that Denver had just finished this Denver Food Vision, and there were these winnable goals set. But also the Denver Sustainable Food Policy Council at the time, that's mayoral appointed, was really interested in pushing this good food purchasing program. So in the first year of our FAR Tipping Points grant, we actually shifted some of the food policy actions that we were looking at because they had decided to adopt the good food purchasing program during this time period. So what was happening, though, at the beginning of the project was that it was just this mayoral appointed council that was really talking about pushing some of the GFP strategies. But because we recognized that there were these regional impacts, and because the city and county of Denver was a core partner on this project, what we ended up doing was providing about a third of the budget that was coming directly from FAR to support Marion Kalb, who you can see in the back center there leading this meeting. And one of the things that she was able to do was set up something called the Good Food Purchasing Program Coalition. So what this did was to bring together Denver stakeholders, including members of the Denver Sustainable Food Policy Council, and we have the Food Systems Administrator, Lane Sidlowski, who's there, but with partners in the region that would be impacted by the ways that Denver decided to pursue the Good Food Purchasing Program. So for example, in the bottom left, we can see our former head of the Colorado Fruit and Vegetable Growers Association, Robert Sakata. And I think having these conversations, you'll see, is really, really critical in helping us to set the boundaries for the project and the research, helping us to understand supply chains, helping to validate data, and helping to really communicate across these different stakeholders that were both pushing policies for different reasons and also thinking about how they'd be impacted. Next slide, please. So we started looking, we focused on 4 commodities, and I'm going to talk about 2 just very briefly here today. And so we looked at the 4 commodities were peaches in the Western Slope. We also looked at wheat, particularly dryland production wheat out in the northeastern part of the state. We looked at cow-calf production, beef production in the northwest corner, and partially we chose that because there's still strong small-scale, small and mid-scale meat processing sector that exists there. And then we looked at potato production in the San Luis Valley. Next slide, please. And just to highlight that part of the reason that we focused on 4 commodities is because even though we have pretty good farm level data through restricted access census and other things like that, and we have pretty good, I would say, at least purchasing data, not consumption data, where we really lack access to good information is along that supply chain. And so we had to really have some in-depth conversations with a bunch of those supply chain partners to really understand both how food was currently flowing and then how it could potentially flow. We focused on Denver Public Schools as our buyer because they're the largest buyer that is impacted by the Good Food Purchasing Program adoption by the city. And then we looked at sort of this baseline, and then we looked at these different scenarios that we came up with the city and county of Denver based on the things that they were thinking. And we really thought then about what the implications were along that entire supply chain, including starting with the production level, where within our modeling, which I'll show you in a second here, we actually started by building these biophysical models. So we're actually growing crops on irrigated or non-irrigated land and specific spatially explicit places. Next slide, please. So I'm not going to tell any more details about the modeling approach than essentially what I just did, except to say that we integrated a number of different data products and models within an agent-based model. So this included economic data, nutritional indices, social decision-making factors, biophysical models, ecological data, and life cycle assessment data. So one of the innovations, I think, of this work is really thinking about how farmers and ranchers are making those decisions, right? That they're not just maximizing profit. So just because, for example, there would be new markets created for a certain kind of product does not mean that a farmer is necessarily going to respond or change anything they're doing. And we have a few papers published on that if anyone's really interested in thinking about that. But I think that's a really important piece to consider. The other thing is that the nutritional indices, you'll see that I'm not going to highlight any of the results from that work because in that research, and again, we have published papers on this, one of the things that we did not find were that as schools were serving, as there are households with schools that ate meals, excuse me, as there were households with kids that were eating meals in schools, we did not find any spillover effects to changes in dietary quality, or that there was any relationship between that dietary quality and having kids eating meals in school. So we really weren't able to build out that linkage within the model. It exists, but we don't have a mechanism to actually change it. And I think that's really important in some of the things that we've been thinking about in lots of other aspects of this work now and future work, because I think there's these assumptions about, trying to get local food, for example, into schools, but it's not clear that there is a relationship there that we want to make sure we're tracking. Next slide, please. So this is the primary slide on our results that I thought I'd highlight. But again, we have published articles and we have some other things that are getting close to being published. So I think the key piece here to note, and this is true across all of our commodities, is that there's trade-offs with each of the different types of scenarios that we were looking at across different types of farm outcomes or water utilization outcomes or greenhouse gas emissions, and that there's no really silver bullet, like everybody wins if GFPP is adapted in this kind of way. And I think that's a really, really key thing, because ultimately it's going to come down to the policymakers to make these decisions based on their values or the values of the people who are really voting for them. And so that's not my job as a researcher to say what is better, what is not. But I think through providing some information like this and having some of these conversations, we can have much more nuanced conversations about really why we're pursuing some of these policies, or why Denver in this case is pursuing a policy, and what some of the potential impacts would be. Another really important thing that we found through this work is that many of our cities are talking about, for example, taking meat out of schools and then what the reduction in greenhouse gas emissions are. And they're using that based on usually global models that exist. For example, WRI has some of these, but they really don't reflect local conditions. And understanding those local conditions is really important. As another example I often talk about in our work with the wheat production systems, we found that where one of the things that Denver was interested in is thinking about certified organic wheat. And even though we found that certified organic wheat, or growing and selling certified organic wheat, was actually more profitable for our wheat growers on a year after year basis, that actually had some negative soil health outcomes, because those producers couldn't practice no-till. And so there were some negative impacts in erosion and some of the other metrics that are important to consider. And so I think through having some of that more nuance in these conversations, it really has made Denver think, I think, more critically about how they're implementing good food purchasing, and really trying to recognize the importance of having these conversations with producers. Next slide, please. And so one of the really important impacts, I think, from this project has been the fact that the mayor and the city and county of Denver have actually decided to maintain this Good Food Coalition, and actually have kept on Marion Kalb and made that position permanent. So our 3 years of funding are coming from FAR to support that. They really saw the value in it and having these regional conversations. There continue to be quarterly meetings. And it's just as an example, we just passed a farm labor bill in the state, and it was extremely contentious. And this Good Food Coalition was the only place where it actually brought together people who are farmers and ranchers who would be impacted by the bill, with some of the folks from the city and county of Denver who were pursuing the bill, and actually have a conversation. The only place in the state where this occurred. Next slide, please. And, one of the other things, as we've been really trying to continue to bring together these rural and urban stakeholders to think about what some of the opportunities are here, we started the Colorado Food Summit as part of the FAR grant, again, thinking about that process piece and how we integrate some of the data into these conversations. And so this started through the FAR grant, and it's now continuing. We're actually holding this, the Colorado Food Summit, this Thursday and Friday, and we have 700 people registered to attend, including a youth summit that we're integrating into a piece of this. So we'll have almost 60 youth, young leaders there as part of it. And so again, I think one of the big impacts of this work is bringing together these regional stakeholders to have some of these conversations before more of our urban stakeholders, who are very well intentioned, are sort of pursuing these things, and really then thinking about how to leverage the data to understand some of the nuance, but still recognizing that values are going to be core to making these decisions. So with that, I think that's all from me. The next slide, I think, has my contact. Oh, I'm so sorry. This very importantly, we go back one slide. So the next steps, so we are, wrapped up the Colorado project, and now what's really exciting is we are going to continue this work with funding from FAR, the Rockefeller Foundation, and actually the New York Farm Viability Institute through some matching funds, bringing in some new partners with Glenwood and Cornell and New York City. And we're going to be looking at something very similar in New York around this regional work. And I think one of the really cool parts of this is that the city and county of Denver are ultimately a pretty small city, and Denver Public Schools is ultimately a pretty small buyer. But with New York, we're looking at a $300 million annual spend on food. And so really taking what we've learned from this project, including places where, we've learned and maybe would do things a little bit differently, and getting to apply this to New York is really exciting. So stay tuned for more information. That project just launched in September as part of the Climate Week in New York City. And so with that, I will say thank you on the next slide to all of the folks that supported this work. And I believe my contact information is on the next slide, should folks have questions, and also the QR code to our website.
All right. Thank you, Becca. And the last team to present is from Albany, New York.
Hi, everyone. Thanks so much for having us today. So my name is Beth Feingold. I'm the PI of this project, and Shabo Shleber-Michael is also on the call and will be tag teaming this presentation. She's the co-PI. Next slide, please. So in the United States, up to 48% of food is wasted or lost before it gets the chance to be eaten. And there are very significant environmental or nutritional costs that are associated with this wasted food. So you could think about the greenhouse gas emissions, the energy wasted, the water wasted, or you could think about something like the 149 billion food meals that are never eaten in any given year. And so that's why there are some more preferred or less preferred strategies for handling wasted food. As you can see, EPA just put out this new wasted food scale. And and it sort of helps understand that it's much better to address this issue as close to the source as possible as opposed to downstream. But that said, there really are a lot of gaps in the understanding and the quantifying of the impacts of different strategies, like different policies or programs, like a tax benefit or an organics waste ban that might be implemented at a local or a state or even a national level to try and address the wasted food issue from either an environmental or greenhouse gas angle or a nutrition and health angle. And so we started this project in 2018 to try and quantify what the environmental, nutritional, and health impacts of food recovery and redistribution in New York's capital region would be, and to understand what that would look like under different policy scenarios, that were going to result from policies that were about to be implemented. And I should say our work is still ongoing, so it's not completed yet. And then with supplemental funding from FAR, we also further sought to understand the impact of the COVID-19 pandemic on this arm of the food system and on regional food security. Next slide. Shaba, I'll toss it to you.
Two principal approaches we use here are life cycle assessment and system dynamic modeling. Life cycle assessment is a systematic model for evaluating environmental health impact of products, process, or systems. Here, we develop a life cycle assessment model to evaluate environmental health impact of food donation chains. And in this diagram, so you see that food flows from donor to the recipient. With the life cycle assessment model, we track the environmental impact from storing, transporting the goods, food from donors to recipient. We also calculate the environmental impact of upstream processes, for instance, producing the gasoline to support transportation. So life cycle assessment is capable of calculating a variety of environmental impacts. Latest effort is also couple life cycle assessment with the nutritional epidemiological model to assess health impacts. The other core piece of modeling is the system dynamics. And the system dynamic model is also a system approach, and which is really good at capturing interactions among system components, feedback loops, and also temporal delays. And specifically, we are using system dynamic model to look at how policies would influence this system. For instance, food-based ban and also tax credit policies. We also use the system dynamic models to look at how the food donation system may absorb shocks and adapt to changes and crises such as COVID-19. I also wanted to mention that our excellent graduate student, Mariana Torres, is the lead in system dynamic modeling. Next.
So I'll take a 30,000-foot view for talking about the results of just these main models. And we have other, like the other projects, there's other components to this five years of research that we're not really talking about here. But from our system dynamic modeling, which was a really participatory approach with a number of organizations that we'll talk about on the final slide that we have, but a very high level sort of finding is looking at, the fact that even well-intended policies can have unintended consequences, right? So some way to ensure and help bolster the effectiveness of policies is to increase the capacity of organizations like the food rescue organizations or the emergency food organizations like food pantries or the food bank to handle increased donations and coordination within the organization and across other organizations. Also, obviously, improving the quality of retail donations that come into the system helps to increase the effectiveness of something like an organics waste ban. From the COVID-19 related modeling, we found what I know a number of the other groups found in very different aspects of looking at the food system, but that coordination and partnerships across actors and across organizations really help to the organizations to pivot and adjust in a sort of post-COVID world. From the life cycle assessment modeling, we really did find that under all the scenarios we looked at, there was environmental benefit to recovering and redistributing produce, though the magnitude of that benefit and sort of the categories of benefit varied depending on the different scenarios that were modeled. We also found a higher environmental benefit in the months since COVID-19 started compared to prior to COVID-19. That may have a lot to do with the fact like programs like Nourish New York, which came into play to really increase the fresh food donations during that time. And from the more epidemiologic side of things, which is, I should note, is being led by Kiko Hassler, I don't know if she's on the call, but using data outside of the system, outside of the data we just collected, but some other data that she's coupled with this, found that doubling fruit and vegetable donations can really help in terms of mitigating cardiovascular health risks in the populations that are utilizing food pantries. Next slide. So like everybody else, we worked with all these great community partners, one of which was the food pantries for the Capital District. And Natasha Pernica, who's also leading up the Alliance for Hunger Free New York, offered a quote about how it's really been helpful for them as an organization and an organization that has member food pantries for them to be understanding, the impact of fresh produce in the charitable food system and how they in their organization or in their member pantries are able to maximize resources and mitigate environmental impacts of the work that they're doing. So that was pretty great. Next slide.
So in this space, we also have a few other projects ongoing. And the first piece is that Mariana is leading a study to look at the perspectives of the redistribution policies from the retail sector and also food assistance organizations. And besides that, we also have an NSF-funded project. 2 years ago, we joined a national center called Recipe. And this is a $15 million NSF-funded research center focusing on basic food solutions. And our UOVNI team within the center is focusing on developing quantitative assessment tools to understand environmental health impacts of food donation systems. Last year, we developed a new partnership with the Feeding New York State. And with the collaboration with Feeding New York State, and we are looking at the drivers for retail donation and also optimal redistribution network to reduce the redistribution cost and also maximize redistribution amount. And also last month, we just submitted a IHP 20 grant along with another 40 faculty in my school. And Beth and I proposed a core on emergency food system and health equity. And with this core, our goal is to enhance research and training in the space of emergency food system and health equity.
Next slide. So we're a pretty big team, maybe not as big as all the other groups, commensurate with the funding, but we have we partner with a number of local and regional organizations, including our food bank and the food pantries, and we've had great students and who have really pushed us in the process. And we have a website, which I actually don't think we linked to, but it's I can put in the chat if folks are interested to see and keep up with what we're doing over at Albany. So thank you so much for the opportunity.
Yeah, thank you for presenting. We got about 12 minutes scheduled left. This is going to be a really short panel Q&A for all the PIs and for FAR. So we'll see where we get to. Y'all had a couple questions. If you have more questions, please put them in the chat. But I'll just start by talking about, one of the things that we did and Rebecca had mentioned and talked about and did was this kind of collaborative structure that led to research successes. So for anyone on this group who wants to answer, can you talk about how Tipping Points or how this program was unique and how the collaborative research structure led to research successes?
I will start us off and then let others join in. But I think this was such a great opportunity for us to collaborate across teams. It's very rare for grantees to be able to meet the other awardees across the funding opportunity and to be able to work together. And so I really want to commend FAR for bringing us together and doing a lot of that facilitation so that we could have regular meetings and that led to some paper publications and also a lot of support, especially through the pandemic when we were able to learn from each other how we do these things that we were planning and had been doing in person as participatory workshops. How do we shift to do that in a virtual setting? And what does that look like? And how can we pivot because of COVID? And so there was a lot of support amongst teams and sharing of ideas, methods. And in addition, that then also resulted in us working through the papers that Rebecca explained. So I think that's particularly important for participatory and community engaged work. So there's lots of room for teams to respond to the needs of their individual communities, but also to learn from others how to do that and what works and what are some other ideas. So this community of practice forming in this way brought us together in ways that I don't know if we would have come together otherwise.
I'll just add one additional comment. I think you heard across all of the presentations, there was a convening function of the projects. So whether that was the summits with Becca bringing over 700 people together, food policy councils, food policy coalitions, Nourishing Power Network, that, how do you connect people across groups and create space for dialogue? I think that seems to be a pervasive piece of all of the projects.
Anybody else have any comments on that?
I just want to, I guess, underscore what Chelsea said about, we may not have ever met because our projects were so different and we come from different backgrounds. And so I think that's one great advantage is that because of FAR, we did all get to meet each other, again, having very different expertise and skills. So I think that was great.
Yeah, I'll have to say that I think participating in some of those calls, a minor sum, I'd say. I learned a lot every time I talked to you all individually or listening to the group as a whole. So it was really, really informative. I'm very happy that Rebecca coordinated and led this on our end to get you all together. So very, very appreciative of that because like you all said, I think that y'all learned a lot from each other and all of that good stuff. All right. Well, I had a whole series of questions to ask you all, but I see that our time is at 8 minutes. So I'm gonna give you each an opportunity to answer just one last question. In the audience, for the remainder of the people who are in the audience still, if you have any questions, just let us know who it's going to and we can direct it to them after the webinar, or you can feel free to reach out to them yourselves. So I guess my last question will be then, my second question, is there anything else important from your research you want to re-highlight or you think is important for the audience to know? And I say that because we gave you all a very, very short amount of time to present, and we know that y'all have done a lot of really great research. So I just want to open it up to you all to talk about if there's anything else from your research you want to re-highlight or you think is important.
I don't know that
Marina,
oh, sorry.
Oh, I'm sorry. I saw Marina had her hand up. If you want to bring up what you wanted to talk about.
Oh, thank you. Yeah, it was related to the previous question. I just wanted to give my perspective from a PhD student. It was also great to be in the PhD program and being able to collaborate not only with my research team but also across the other teams. For example, in this I recently collaborated with Chelsea and another student from Michigan University. So I think that was very helpful for me. And I think like projects like this would be very beneficial for other students as well.
Great, thanks for bringing that up. We also, in addition to the question I asked, if you want to answer it, we had a question from the audience and any tips on how researchers can best collaborate with community partners in the food system. Strengths and challenges.
Well, that's actually related to what I was just going to say to your question before is, I think I cannot emphasize enough the importance of trust in doing this work. And trust is not built easily. And it really just takes so much time and thoughtfulness. And I'll tell you what I've learned even just from doing this Colorado Food Summit, where we started smaller, to plan this event. We spend the entire year planning it because we need to be so intentional about every aspect of it, who each speaker is, how people are brought together, making sure that, we're really being thoughtful about different needs and accommodations. And, so I have realized through the work I do that if you can't do it well, it's not worth doing. And I don't think I would have said that prior to this project.
I would second that and also add that it's very helpful to have our funders build in time for that research, right? So if you're pressed for time or have this kind of external time pressure, that's not necessarily the same time pressure that communities are experiencing or facing. And so having the ability to take time so that we can be responsive to community needs and questions and pivot as needed, that's so important, but isn't always supported. And so having that kind of flexibility and understanding that we're all doing this type of community-based work that needs that flexibility, getting support from each other, but also from FAR on that, I think is really important.
All right, any last words from anybody else on any things you want to impress upon the people who are on the call still or who will be listening to this recorded webinar? I can't believe nobody has anything else to say. Y'all are.
I mean, I would say that there was not necessarily sharing from my specific project, but more this process as a whole, and the uniqueness of this funding announcement that came from FAR was so specifically right on, that sort of exactly what we were trying to do, which we had previously found it very difficult to find the right kind of home for this work. So it was one of those instances where, it was really a great match. And just a thank you, I guess, to John and the team over there for facilitating that. And I think that, coupled with the necessary part of the community engaged work and the matching funding, was a unique and really it really gave a lot of life to the project. I think those aspects of it. So just wanted to share that.
Great. Well, I will have to say that we appreciate the work that you all have done, the team here at FAR. We know it's really important work, and we're really happy with the progress that you have all made. All right, 2 minutes left. Any other last words?
I just wanted to share, I think sometimes we think that complex problems can't be solved. And I think one of the things that we learned in this work is that there are ways to solve complex problems, but it's going to take a different approach. And like you heard Becca say, it's about trust building and relationship building and deliberation and trial and error. And I mean, even with the work of Sandra's group, seeing the different policy scenarios, playing them out and making decisions. So I feel like it is exciting to see the possibilities. And I think the future is, what does it look like to put those things into action across at scale, right? So I'm excited to see where each of our projects go and to stay connected to this group.
I am also excited to see where each of the projects go as well. All right. Well, that's the end of our webinar for this Tipping Points program. Again, thank you to all the researchers. Thank you for being on this call. Thank you for the work and the engagement and all of the stuff that y'all do on a daily basis, including this part of the FAR project. So there's a recording of the webinar. I think we can put you in contact with the PIs if you're watching this recording or have questions about it, if you don't have their contact already. Rebecca or Tatiana, am I missing something else?
Nothing,
That was
John.
everything.
Good. Yeah, that's everything.
Well, here we are. We are at that 4:30 exactly on time. So once again, thank you for being here. Thank you to the grantees, and y'all have a good holiday season.
Bye, everyone. Thank you.
Thank you so much.
Thank you, everyone. Bye.